Hi, my name is Ramin Tayani, MD. I'm an ophthalmologist and an oculoplastic surgeon, also the medical director at Dermabear. Dermabear is in Lifetime Athletic Club in Laguna Niguel, Orange County. I'm here today to introduce our nurse, Ida, who's been with us for a very long time. Actually, before I even started Dermabear, she was a laser hair removal nurse with one of my very good friends. And when I started Dermabear, she joined us and has been with us for over 10 years now. How long has it been, Ida?
2006.
2006, so she's been doing it. So we're going to talk about laser hair removal today in this clip. So Ida, tell us, what kind of patients are good clients based for laser hair removal?
Right now we have different skin type for laser hair removal, from skin type 2 to African American, and we're very comfortable to do laser for all of the skin type right now. Before, like when we start 2006 with laser hair removal, it's just Alexander. Alexander wasn't that good for dark skin, but it was very good result. After that, Dr. Tayani always liked to update the best machine and the up-to-date laser machine. That's why every time the new machine come to the market, we purchase the new one. Do you remember we purchased the Luminous in 2009 or 10? Then after that we updated, and 2018 the Splendor X come up in the market, and Dr. Tayani purchased it. The Splendor X is the combination of the Alexander and YAG. Luminous and Alexander, they come up with the newest machine. It has a cooler system. It's very comfortable compared to the old machine, and we use that machine right now.
Yeah, so one of the things that we found in laser hair removal is the patient type. Ida used the skin type 2, so the skin types are graded by the color of the skin, and the lighter the skin, the safer the laser. The darker the hair, the more efficacious the laser. So the best combination used to be darker hair, lighter skin, but not everyone comes in with that combination. So as Ida was mentioning, one of our earlier lasers, the Alexandrite, basically had the risk of hyperpigmentation and hypopigmentation, skin discolorations after laser. But as technology got better, we engaged with the better technology, and we were able to perform more aggressive lasers and yet still remain safe. And Ida is one of our most aggressive nurses, but she's just because she's done so much, she can really treat any skin type.
I want them to see the results.
Well, and that's a very good point. You know, a lot of places you go and they're very, very gentle in their power that they use, but you'll get some reduction of hair, but not really the amount that you expect. When Ida gets to do the treatment, she really goes as aggressive as possible to try to get you the best treatment, yet hopefully avoid the potential complications. But we can also talk about the complications.
Yeah, I always tell them, you hate me inside the room, but you love me after, because they see the result. And the good thing about the Splendor X, they have a version for fine hair, dark hair, tan, lots of
and also the skin types too, right?
Skin types, yeah.
So the darker skin can be also, even to the point of even African American black skin can be.
We have a client, African American, and they see a good result.
Right. So one thing to remember, and you'll see this in the consents, that hypopigmentation is a possibility, but we've hardly ever seen a patient not resolve from those complications. So even though it can happen, it's typically temporary. But again, if you're not willing to take the risk, either let us know so we'll minimize the power, or you shouldn't do it. If you're willing to take the risk, then know that you'll have a great result, but there is, like anything in the world, you have a potential, not that you will have a potential. And I think our numbers are less than 1% complication rate. So 99% of our patients have no complication. So if anything does happen, our nurses, both Ida and Candy and all of the other nurses, they're very, very experienced with this stuff. They will handhold you through it. I'm available. I will handhold you through it. So you're not left alone. Why us, Ida? Why should anyone come to Dermabear as opposed to all the different laser hair removal places that are out there?
I think most important, we have a client, they're happy with the result, they bring the other person, because I have lots of clients, they come from the other center, they didn't see a good result for any reason, I don't know, but they come back to us and they see the better result. And the most important, best machine, know the setting and done for.
That's true. I mean, our machine is the latest technology. Luminous has a tremendous reputation and a great product. I think Ida is being very, what's the word I'm looking for? Humble. She's being very humble. She's an excellent nurse, not only for laser hair removal, but also injectables and other lasers that we do, which you'll hear more about in our other clippings, our videos. But our location, I mean, we're in Lifetime Fitness, which is very convenient. It's right off the 73 and the 5 freeway. We have parking right here, steps away from the structure. There is childcare available. You can use the gym as a Dermabear client. You can use the gym for a day, and it's a great facility. And we have done probably we counted this one time. We're over 50,000 laser hair removal cases. So it's hard to find a place that has that kind of experience and the longevity. I mean, our nurses, myself, we've been with our company for over a decade. So, anything else you wanted to share with the patients about laser hair removal? We covered it? Yeah. Oh, before and after care. Let's talk about before and after care. So, the most important thing, and correct me if I'm wrong, it's basically you want to make sure you're as pigment free as possible. So, you can't change what God has given you, but you can change your exposure to the sun. So prior to laser hair removal, we want to have the least amount of tanning, if none would be best. So if you are tanned, you are more, potential for pigmentation. And then what is the rule for after the laser? How long do you want them to be avoiding the sun?
After laser, it's just 1 week, it's okay. Then their skin back to normal, they can go to sun, but I don't recommend it because they get tanned for the next session. It's better stay away from sun during the laser time. But if they have to, or if they go somewhere like the area they have to let me know to adjust the setting.
Yeah, and
it doesn't recommend it for whoever is pregnant, breastfeeding, and when they come for their laser, they have to fully shave.
So shave before. How long before the laser?
Same day.
So shave before.
They cannot use epilady. Whatever it's removed the follicle, they have to skip it. No epilady, no waxing.
So just shave would be best the day of or the day before. Again, let's just go out and talk about the best candidate. The best candidate is someone who's lighter skin, darker hair, coarser hair is better. Finer hair is a little more challenging to treat.
And usually they need 6 to 8 sessions every 6 to 8 weeks.
One other thing we should talk about is it's not laser hair removal, it's laser hair reduction. Now, having said that, if you fit the combination that we talked about as the best combination, then you actually probably will see no more hair growth. And age has a factor, sex has a factor, because testosterone is what drives hair production. So male men are going to have a harder time having no hair after laser hair removal. Women, if they're a little bit older, their testosterone production is less. Those are all variables to consider, and those would be some things that will be discussed in your consultation.
And lots of mom, they asking me which age it's good to bring their daughter for laser hair removal. I always recommend it at the age of after 18 or 20, 21 because it's the hormonal situation.
So that's an important thing because I have two daughters and they started getting their lasers at I think 13 and 14.
Yes, yeah.
So you
that's
can
the-
do it.
Yeah,
It's just that you have to do it more frequently.
Exactly.
Right?
And I always tell them you can start it at age of 13. The best reason I can tell you it's you have three choices, even wax or razor or laser. None of them at that age, they're not going to see the 100% result, but at least they see better result compared to razor and waxing. That's
It's more
why
comfortable,
it's more
and it does last
comfortable, and
longer.
they see the result eventually.
Yep. Anything else?
No.
All
that's
right.
good,
Well,
yeah.
thank you for joining us in
Thank
our
you.
video of laser hair removal. Again, Ida Pedar, one of our nurses, and myself, Ramin Tayani, MD, Medical Director. Thank you for joining us. Till next time.